Imagine you suddenly wake up at night and then all of a sudden you have strange feeling. You feel angry, feel helpless, feel depressed, feel guilty, and feel panic while being constantly tormented to insomnia, night terrors, and haunting flashbacks. And this experience happens every day in your life. This is the thing that people with PTSD experience in their life. If you don't know what PTSD is, PTSD stands for Post Traumatic Stress Disorder. It was originally recorded during the World War I when the soldiers developed battle fatigue. Many people don't know the seriousness of PTSD and how it affects people and their daily life. So, I want to inform you about PTSD, what causes it, the symptoms, and how to get the treatment of this disorder. So, PTSD is a mental disorder that can occur from the experience or witnessing of a traumatic event. A traumatic event is a life-threatening event such as military combat, natural disaster, terrorist incident, serious accidents, or physical or sexual assault in adult or childhood. Most survivors of this trauma can return to normal in just short of time. However, some people will have stress reaction that can live on their own, or may even get worse over time. With that condition, these individuals may develop PTSD. Maybe you ask how we can identify the symptoms of PTSD. The symptom of PTSD can begin right after a traumatic event. PTSD is not diagnosed unless the symptom lasts for at least 1 month and either cause significant distress or interferes with work or home life. So, in order to be diagnosed with PTSD, a person must have three different types of symptoms. The first symptom is by reliving the traumatic event. There are a number of ways in which people may relive a trauma. They may have upsetting memories of the traumatic events. These memories can come back when they are not expecting them. At the other times, the memories may be triggered by a traumatic reminder, such as when a combat veteran hears a car backfire, a motor vehicle accident, victim driven by a car accident, or a rape victim sees a news report of a recent sexual assault. These memories can cause both emotional and physical reaction. Sometimes this memory can feel so real as if the event is actually happening again. This is called a flashback. Reliving the event may cause intense feelings of fear, helplessness, and horror similar to the feelings they had when the event took place. The second symptom is people trying to avoid situations that triggers memories of the traumatic events. They may avoid going near place where the trauma occurred or seeing TV programs or reports about similar events. They may avoid other sights, sounds, smells, or people that are reminders of the traumatic event. Some people find that they try and distract themselves as one way to avoid thinking about the traumatic event. Sometimes, people who have PTSD may find it difficult to be in touch with their feelings or express emotion towards other people. For example, they may feel emotionally numb and may isolate from the others. They may be less interested in activities that once enjoyed. Some people forget or are unable to think or talk about important parts of the events. Some think that they will have certain lifespan or will not reach personal goals such as having career or family. And the third symptom is people with PTSD feel constantly alert after the traumatic events. It can cause difficulty sleeping, outbursts of anger or irritability, and difficulty of concentrate. They might find that they are constantly on guard and on the lookout for signs of danger. They might also find that they get startled. So, how long does PTSD last? It's variable. It can be different for different people, and that can change over time. PTSD usually begins right after traumatic events, but it can also be delayed for many years. PTSD usually involves periods of symptom increase followed by remissions or decrease. For most people, symptoms improve over the first year. The treatment can reduce symptoms, but some individuals may experience symptoms that can last for a lifetime. PTSD can be dangerous if it left untreated. This disorder will make sufferer difficult to trust, communicate, and solve problems. This can cause problems in relationship with friends, spouse, family, and co-workers. In addition, this disorder can also affect physical health, such as increasing the risk of heart disease or digestive disorder. Now, I have explained everything about PTSD, and now I want to tell you how to get treatment from this disorder. PTSD can be treated by a variety of forms of talk therapy and medication. There is no single best treatment, but some treatments appear to be quite promising, especially cognitive behavioral therapy. This therapy includes a number of diverse but related techniques such as cognitive restructuring, exposure therapy, and eye movement, desensitization, and reprocessing. PTSD cannot be prevented, but there are several ways you can do it if you experience traumatic event. For example, talk to your family, friends, or therapists about the traumatic event incident that you experienced and try to focus on the positive side, including when you are experiencing a traumatic event. My name is Zhidan Ronald Delpiero. Thank you for listening.